Hi, Dr. Saxena at Form Health Tampa and Chief Medical Officer at Form Health. Wanted to teach you something that some of our providers use as logic as to whether or not to order a test. And it's for those of us who love math. I'm one of them. And this principle is called pre-test probability. So said differently, I'm going to explain it in a fun example. So let's say you come to see a healthcare provider and you look like a duck, you act like a duck, you quack like a duck. I mean, you really think you have duck disease. And then the provider says to you, let's do the duck test, but let's also do this horse test. And the horse test is going to tell you if you're a horse. Now, you might be thinking, why would we do a horse test? See, sometimes when you order tests and you do tests just for fun, oh, let me just see, your pre-test probability of being a horse is super low. So if you do that horse test and it comes back and it says you're a horse, I want you to know that labs are not perfect. And let's say it does say you're a horse. Do you really believe that test? No, the pre-test probability was super low that you were going to be a horse because you really act like a duck. So it makes more sense to do tests that might be a duck test or a platypus test, because that might be really telling, because I'd treat you differently if you were a duck versus a platypus. But if that horse test comes back positive, am I really going to run down the pathway of you being a horse? No. So as you're trying to figure out which types of tests to do, put your eggs in the duck basket, right? Figure out how to use labs to confirm things that have a high pre-test probability, because otherwise you can go on many wild goose chases, and that's not good for your time, your energy, and your resources. Hope this was helpful.
Hi, Dr. Saxena here, Chief Medical Officer at Form Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.